Thank you, Renee, and I really appreciate all the mentors that I'm having at Mount Sinai and collaborators to help me better understand that the brain and heart and immune system connection. So this is one of the projects, part of my collaboration on this area that really spun off during the pandemic, and it was a great way to connect with people that I didn't know, other faculty members who have common interests, but looking at it from a different way. And the other thing too, that the COVID and the pandemic has pushed us to adopt new technology that is touchless, and where you could remotely collect data on your subject because of the pandemic, but also taught us that this also can, and in the future, translate even further. So I'm going to talk to you about this work that we call the Warrior Watch, and I will explain to you what that is. And this is using that Apple Watch to measure stress and resilience in healthcare workers. And I'm also going to cover to you how we started this program in terms of the COVID and the infection leading to this work. So I don't need to motivate you too much about this. A lot continues to be written and discovered in terms of the impact of COVID and the COVID infection on people, so and especially also on the vulnerable population, and one of them is the healthcare workers. So these healthcare workers have a threefold increased risk of COVID infection because of the work they do, and 35 of people are asymptomatic carrier but are contagious. So there's a need, obviously, to try to detect this disease differently. The other aspect, and this is what we're talking about, and this really is the work by my colleague, who tried to understand the psychological impact of COVID. But in this case, I'm going to talk to you about our work looking at healthcare workers, where they have been a lot discussed. And as James mentioned, this is going to remain for a very long time with us, the aspect of depression, anxiety, insomnia, and distress. So mobile health or mobile technologies is on the rise, and it's here to stay. And we have seen the impact of telehealth during the pandemic, but also the adoption of multiple tools, technologically based, mobile based, and it's predicting that this is going to have and continues to have an impact both from a patient or subject research and clinical delivery of healthcare, but also in terms of the impact financially related to this market and to this procedure. So the Warrior Watch project had two intentions. Number one is dividing what we call a Warrior Watch infection study. And it's really to use these physiological metric as well as the psychological clinical assessment to understand the effect of the infection on people. And can we use these measures to try to detect the disease differently? And the other one is more related to what you're interested in here is the Warrior Watch Mind study, and trying to decipher the psychological impact of COVID on our healthcare workers across all occupation using these, again, mobile health solutions. And the mobile health solution that we have adopted, and this is really thanks to knowledge and work that we have at Mount Sinai, especially with the Hasso-Plattner Mount Sinai Institute and the group that is expert in working with application and adopting these apps from your different platforms and different wearables to try to detect the disease. So we've worked and specifically in here using the Apple Watch. This is the one I'm wearing also here, to use the Apple Watch to get real-time 24-hour assessment of physiological measures that include, as you know very well, heart rate, and we'll focus a lot on heart rate activity, variability, but then other things being also measured. But I'll show you why the heart rate variability is an important measure here for us. And we marry the watch with the Apple Health app that we can access. and create and modify a specific application of the Warrior Watch, where we could get subject to a journal to us what is the clinical symptoms that they're getting, and specifically here, what are the COVID-19 symptoms, but also more importantly is the aspect of psychological well-being with different instruments and that we can put via this app in a very friendly and I would say, doesn't take a lot of time to do, and you will see that we've had a very high level of compliance. So the surveys that we ask will be related to the infection as mentioned, but let me also stress the aspect of the surveys we use for resilience, stress, optimism, emotional support, quality of life, and other physical markers of stress on the body. So the heart rate variability is one of the measures that we focus on. It really measures the activity of the autonomous nervous system. Our body continuously readjusts to maintain this balance. So actually heart rate variability is important, and it's actually essential for that balance. And it obviously it is something that has an effect on the autonomous nervous system, on the heart rate, monitoring or modulating heart rate, blood pressure, glucose, etc., to keep everything in balance. And this is a very important marker to try to assess basically disease, but also health. And it relates to this interaction of our autonomous nervous system, of both the sympathetic nervous system and the parasympathetic nervous system. Okay, so let's start first about maybe just to give you a sense of this program. Let's start with the infection prediction, although here our focus is not, for this symposium, is not necessarily the infection, but this is a good example to show you, how our story evolved from looking at the infection all the way to the aspect of stress, which we'll finish with. So again, the platform can do both. We can get this assessment by patient, but also measure this heart rate variability in real time. All this, it's important to talk about this, deploying this contactless, especially during the pandemic. So you're able to continue to do measurements on subject, on a patient, without having to see them face to face, because that creates obviously difficulties, obviously from an operational point of view, but also from a safety point of view also. So in this part of the study, the part one related to infection, we've enrolled over 300 patients from April to September of 2020, and the median age of these healthcare workers are 36, 70% women, and about 7% reported having a positive COVID PCR test prior. We measured and conducted this with a 42 days follow-up. And one of the things that's important to point out here is, using this technology, we noticed that compared to other studies or other ways of collecting this kind of data, that we had a very high sustained participation, over 70% in the study. So that, I think, is a good lesson in terms of deploying these tools and the importance of having compliance and making sure you have high compliance so you can have a very well performed study. Let me talk to you a little bit about the infection detection and how we looked at this. We looked at this over over a period of somebody looking at the daily heart rate variability on days with COVID positive and COVID negative diagnosis, and being able to look at one of the parameters. There are a lot of ways you could measure, you could process the heart rate variability. I'm not going to dive a lot into the detail, but just to show you here on the, let me see if I can get my pointer to cooperate. Not easily. On the left-hand side, you can see the significant differences in heart rate variability, both pattern and amplitude in the two groups who are COVID positive or negative. And we can see now, when we break it down into the COVID negative healthy, but trying to see, are we able to look at these daily patterns over time to see if we can detect different signatures, prior or after the COVID positive. So you can see now, if we look at the healthy, a very nice waveform pattern, high amplitude, specific signature in terms of what how it looks like. But now when you have somebody is 1 week before the COVID positive test, now we have major changes in both the pattern but the amplitude. It's really obvious, and you don't need much sophisticated person to see that red curve now compared to the green curve is very different. But now if we look at now longitudinally, 1 week after the COVID positive test, the waveform continues to be different, but starting to get the shape. When we see now 2 weeks after, now it's starting to gain similar to the healthy, but it's a different amplitude, but the pattern is there. So you can see that these patterns or the amplitude of the signal is very much related to the COVID infection, or any infection, I would say, in general. And it's very much, in a way, important. It's important that we're able to detect it much before somebody is symptomatic. So you can see here, this is a very intriguing way of potentially finding infection in general, and using that information to maybe isolate that subject, just so you can err on the side of caution. Very simple, so you don't have to get that swab, and could again be important managing the infection during the pandemic. Okay, so now to get to the meat here that you're interested in, which is the aspect of the psychological well-being. Again, using the same platform that I just discussed with you, related to heart rate variability measurement by the watch, as well as the surveys that are done by the subject in a very friendly manner, and deployed via the app on the phone. So our goal here, just to restate it, was to understand the psychological impact of COVID, and specifically looking at vulnerable patient group, or subject group, I should say, which is the healthcare workers. And this was done really across our Mount Sinai health system and across all occupations. This is too much detail, but just to tell you, in terms of the instrument that we've used, these are well-established and validated instrument. We've used most of the time the short, I will say, version of these instruments, the resilience scale, the life orientation test, as well as the general health and the quality of life. Again, all programmed in a nice way and can be done very fast. I was one of the subjects that also participated into the study. I was able to do this on a daily basis. It didn't take too much of my time, and I was, tried to be, and I was compliant, because again, it was not too onerous in terms of effort to be able to do this. And these are important things when you are designing mobile health applications or testing, to be able to make sure that the technology you're using is not asking too much from you, especially if you want to collect data on a daily basis, but also over a longer period of time. So in terms of about our cohort, about 360 in this case, we have distribution between staff, but also in terms of clinical clinical non-trainee, as well as clinical trainee. And you'll see this was important to be able to divide that, because you'll see there are some trends in terms of these different healthcare workers groups. And so one of the things that in terms of baseline, the clinical trainees had higher baseline resilience versus on the CD risk-2 test, versus the clinical non-trainees as well as staff. There was higher optimism also in these clinical trainees, by looking at the life orientation test and emotional support versus the staff. And also the clinical trainees had also higher emotional support compared to the clinical non-trainees. Now, looking at the longitudinal factors associated with the, factors associated with longitudinal stress, we see that there is increased longitudinal stress as the number of the COVID-19 cases rise, as well as we've also saw increased longitudinal stress when there was 4 weeks before a COVID-19 diagnosis. Decreased longitudinal stress happened in people with baseline resilience, with baseline emotional support, and baseline quality of life. So all these were important factors in terms of that stress, perceived stress on the subject. And occupation and COVID-19 related work exposure was not associated with the long-term stress. So what have we learned now in terms of looking at the change in perceived stress? So we've seen change in stress after COVID-19 diagnosis, with decreased only in people with high emotional support or high resilience. Very interesting, obviously, finding. And change in stress related to the COVID-19 case number was tied together only in those with high emotional support or high resilience. Now looking at the physiological stress analysis, and again, relying on this heart rate variability measure, we see again these, as we've seen in the infection, there's significant reduction in heart rate variability between participants here, in this case, with high versus medium and low emotional support. And then we've also seen, significant changes in the circadian pattern of heart rate variability when the cohort was stratified based on the baseline resilience. So these really, finding, demonstrate to us things that we've known, I think, or in the literature has been known, but really measured here uniquely, and also in a unique setting, that demonstrate that low resilience, emotional support, and quality of life, can identify healthcare worker at risk of perceived and physiological longitudinal stress secondary to, let's say, a COVID-19 pandemic. And then this assessment of healthcare worker for these features can help, obviously, permit an allocation, of psychological support. And you will hear, from Dr. Marin about how Mount Sinai is doing this, but also looking at, isolating or figuring out who is at risk during the pandemic, and really redeploying also these healthcare workers to try to manage this. And I'll finish with you with a study that is a third study of this program, of the Warrior Watch Health. We talked about the infection, we talked about the mind, but also now we are launching what we call the Warrior Shield. And the Warrior Shield is focused on trying to see if we can build resilience by using one of the established tools, which relates to biofeedback. The tool specifically is called HeartMath, and it's been shown to improve patient or employee satisfaction in organizations, as well as being effective in dealing with anxiety and depression, and also building resilience. It's been tried in the many healthcare system settings in the past. It's just to give you a little bit what it is. This is in the area of biofeedback. It's also in a mobile health platform. You have a wearable sensor that you attach to the subject earlobe, and then you have an app with some training that helps you look at your heart rate, and with some practice sessions related to managing stress, but also managing some breathing, etc. You reach, and you learn how to reach that state of coherence, and affect, obviously, in a positive way, your heart rate variability, but also, as shown in the previous studies, shown that how you could manage and build resilience. So the Warrior Watch Shield, study is launching, soon. We are waiting and pending IRB approval, and we plan to test this in our cohort of this 500 healthcare workers that we evaluated before in a 5-week intervention. And we hope to report on that very soon. So with this, I finish with, again, all the mentors that in the field of psychiatry, psychology, including James Moreau, Dennis Charney, and others, but also my partner in crime really takes credit here, Robert Hurton, who is a GI doc at Mount Sinai that I met through the COVID pandemic. We were what we call the COVID kids, getting together, learning about what they're doing in their field of research, and trying to see how we could synergize by building these mobile health application to look at these interesting parameters. So thank you again for your interest.
Thank you so much, Zahi. That was great. And I don't think I overpromised that this is really a revolutionary way to follow people and have direct clinical implications. So thanks so much for that. There are two questions that came up for the Q&A. I think we have time to address those. One by Evelina and one by Lana. If you could read them out and answer them, that would be great.
Yeah, let me get to that thing. So the Evelina is the first question. Yeah. So yeah. Thank you. Okay. So the question is, are you able to analyze disturbance in circadian rhythm? Yeah. So no, we have not looked at that yet, but we are interested in circadian rhythm in general, and I think it's obviously related very much to the aspect of stress and managing stressors in general. So that would be of interest to us, and we are certainly looking at other sensors, including Apple Watch, but also other sensors to be able to monitor that. The other question is about the effect of quarantine without infection. We did not look at that, but that easily can be done. And part of the surveys, you could look at that. Lana's question, Lana, as these become more popular, I wonder what protocol risks are in place for people or for person who indicate severe psychological symptoms and or those who indicate suicidal ideation. I'm going to leave this to Dr. Marin. I mean, Dr. Marin is, with her program, is putting together ways to manage this and to deal with this and build in all different tools. So I hope that this mobile technology, again, is a window to people's mind through this physiological measures that, again, help us, with management of these subjects. So we're very excited to learn again from this group and to continue this collaboration. Thank you.